Hello, I'm going to be presenting dietary outsourcing in a small rural hospital. It's going to be an analysis of the economic benefits of outsourcing dietary services within the Heart of America Medical Center. My name is Erik Christenson. I'm the Chief Operations Officer at Heart of America Medical Center. I have served at this facility for the last 10 years and at my current role for the past year. Heart of America Medical Center is a small critical access hospital in north central North Dakota. We serve about 13,000 patients within our population area. We have 25 beds as we are critical access. We have 4 clinics, primary care clinics that service our hospital. And we also have about 300 employees within our health system, and we are the major economic hub and employment hub of our community. Outsourcing. Just to give you a background of outsourcing, and this is defined by Paley in his article, is basically taking the activity that you currently do in your own organization and moving it outside of the organization, taking that task from an internal source to an external source. Outsourcing can be viewed to decrease inputs or input costs, decrease or increase revenues, increase skill sets, meaning adding some expertise into your facility, reducing non-compliance, especially if you have added skill sets to make sure that you're meeting all the regulatory needs of your organization. Improving management, reducing capital requirements. Outsourcing also has some risks. Namely, it can decrease institutional knowledge. As you stop doing a service, you may lose or lack skills that you need to restart that service. Lost control over staff. You no longer have all the say that you may need over your staff. There is an element of decreasing the morale of your staff when you outsource, and studies have indicated that. In fact, Lisowski and his colleague here indicate that is indeed one of the risks. And of course, you become dependent upon the vendor. A basic framework as provided by Fox and his colleagues here for outsourcing is one that I'll utilize during this analysis of outsourcing in Heart of America Medical Center. Start with an outsourcing opportunity, and then from there you define the tasks that you want to outsource, task definition, then of course you need to find a vendor. Finally, you make your outsourcing decision, whether or not you want to go with outsourcing or not. And finally, you have to review your vendor performance. You have to evaluate a vendor just like you'd evaluate an employee. Heart of America Medical Center is not new to outsourcing. We have outsourced revenue cycle, at least portions of our revenue cycle, to some success. And of course, as pointed out in the literature, many facilities have outsourced either portions or all of their revenue cycle. This is not uncommon within the healthcare sector. Dietary is also seen as an outsourcing opportunity. In our institution, it's an area of high cost, about $1.3 million in annual expenditures a year in that department. There have been some decreases in HCAP scores, or quality indicators, that are used by our society to determine the quality of services within the health system. And of course, employee turnover has been a little higher than we would like here at Heart of America. So, the outsourcing tasks that we'd like to look at. When we look at a company, what they need to provide is basically dietary services with an added level of expertise, some added culinary expertise. So we want to see a little higher level of food services. They have to meet our staffing needs. So we want to make sure that if there's a shortage of staff for our dietary services, this company will indeed provide those needed staff. Of course, assure good quality. We want to see HCAP scores increase, and hopefully decrease costs or improve revenues. So for this presentation, I'm going to call the vendor that we look to vet for this program as Vendor A. Not the real name of the vendor we're looking at, but I'm going to just call them Vendor A. And Vendor A is selected to provide at least a proposal for our outsourcing. And of course, when they came there for their proposal, they indicated that they could provide an estimated cost savings of about $17,000 over and above what it costs for our current operation to provide dietary services. Of course, when I break that down and say that they had an 80% chance of decreasing costs by $17,000, there's a 20% chance that they could increase costs by $25,000. When you break that down, the actual costs are actually about $8,600 with a standard deviation of $16,800. So there's a large chance that we could actually even lose some money in this vendor relationship. Vendor A, however, had a 98% customer retention rating, which indicates they provide good service. Our extensive culinary training is provided to all the management staff on off-site training. So they hire our staff and provide them with excellent training, so that's a definite plus. And of course, the vendor contract needs to be reviewed. We reviewed the vendor contract to assure that everything they stated they would do is actually within their contract, so they are held to that. Here's just a little summation of the numbers that were given to us by vendor A as opposed to Heart of America Medical Center. You can see expenses for salaries, raw food expense, employee training, supplies, and retail sales. I believe you can get a little more retail sales with vendor A and the services they'll provide. And of course, their raw food expenses less due to their better buying contracts. There's a little more management involved with vendor A, so they have a little bit more employee expense. Of course, with outsourcing, there's always ethical concerns. Hucks and Nichols in their article, and that article was actually based on rural education and food outsourcing within rural education. And they do bring out the idea that you always have to take into ethical concerns. You may save money, but you're going to decrease employment and possibly decrease the volume of dollars running through your economy in a small rural community. So you need to take those concerns into consideration. The outsourcing vendor needs to be managed and monitored. So you're never going to get rid of the means or the responsibility of management. You're still going to have to manage this vendor, much like you would a management group within your own organization. And of course, dietary leaders, I believe, should be included in the decision. And in our situation, we included the dietary leaders just to see where their comfort level was and how this would transition would work out. This is just a comparative analysis. It's not a cost-benefit analysis because I don't know future costs and some of the detailed costs, but just kind of a comparative analysis of the two choices. So if you look at the benefits of outsourcing, possible decrease in input costs, although we said that may not be a reality, it may get more expensive. Less management responsibility, at least of the staff and of the turnover. Increased service quality and highly skilled staff. And then the costs, possible decrease, or possible increase in inputs. Decreased employee morale. In the study here that I have referenced, the bottom there said that you could decrease morale in about a 30-year patient, or a 30-year employee population, so about 34% would actually decrease morale, not just those in dietary, but across the whole institution. Loss of control of your service, and ethical concerns like I mentioned, and of course loss of skill sets. Once you outsource a service, it's awful hard to restart that service if you would want to in the future. Of course, based on the final decision, look, given all the facts with the expected costs, you know, that seemed to outweigh the expected benefits. It seemed like costs were going to cost us more than the actual benefits. As our institution, we decided not to go with vendor A for outsourcing. We decided to manage it within ourselves and see how we could do. So what now? So dietary was supportive of this decision to not outsource the vendor to a vendor. So dietary was given a year to implement a process improvement plan. They're basically given the instructions to start a standard operating procedure. And of course, using that standard operating procedure to improve education and upfronting of their employees, so they had better training up front and there was less confusion about what you expected out of them as employees. Advanced food training. So we were putting our managers through their advanced food training programs so that they will be better skilled in their management of the dietary services. And of course, we're going to try to work at increasing retail sales to decrease the waste. I do have listed there the price elasticity of demand as determined by the USDA at negative 1.02. And that just indicates that if you decrease prices by 1%, the volume will increase by 1%. So really it doesn't offset. Decreasing pricing won't increase volume enough to offset any kind of costs. So we're going to have to find other ways to increase retail sales, either through advertising or for providing some more convenience to our employees or to the people of the community. And of course, decreasing staff turnover. We're hoping that the standard operating procedure and some advanced management training will help decrease that turnover. In conclusion, outsourcing is a very complex decision. A lot of factors need to be thought about when you look into these kind of processes. Many factors consider that that normally you don't think of. It's not as straightforward as you think, and there's a lot of steps along the way that you need to consider as administration. The decision not to outsource in this time needs to be reconsidered. If we find that the goals set before them of decreasing turnover, decreasing expenses, or increasing revenues and improved service through HCAP scores aren't achieved at the end of 12 months, we will reassess the outsourcing decision and recontact vendor A or another vendor that is willing to do this service. My references are listed here. Again, I thank you for your time and appreciate the opportunity to present this to you.